talk about embolism, you have to keep one thing in mind, that is any patient who has got any thrombotic condition. Contraindications की आप जब भी बात करते हैं, you must have known this thing, that there are certain absolute contraindications, there are partial contraindications. I am telling you about absolute contraindications का मतलब है इन कंडीशन में आपने पेशेंट को कार्डियक रिहैब नहीं करानी, ठीक है. So the BP range would be higher than 200 by 100 millimeters of mercury. That patient will be the absolute contraindication. Then anyone who is suffering from moderate to severe aortic stenosis. What is aortic stenosis? Aorta is one of the biggest vessels of your body according to the diameter, right? And it is the main artery that is supplying blood to your whole body. Your head and neck, your upper limb, your lower limb, whole of the body is just able to receive the blood because of your aorta. And if there is any abnormality in which the aorta is stenosed, what is stenosis? It is just narrowing, right? So moderate to severe aortic stenosis is again an absolute contraindication. Sorry. Then any acute systemic illness, or the patient is reporting fever, or the patient is having uncontrolled hypertension, or the patient is just unwilling to do exercise, or if anyone is having any kind of orthopedic problem that involves in which the exercise is contraindicated, these are all the other contraindications of your cardiac rehab. So what will be the core components of our program? You can just, if you want to write it down, you can just write it down. There are around 8 to 10 core components of your cardiac rehab. First of all, patient assessment. Then you are going to do follow the nutritional counseling, weight management, the BP management, lipid management, diabetes management. You have to talk about tobacco if someone is a cigarette smoker or a tobacco addicted person, then the tobacco cessation. Then there will be a psychosocial management, exercise training, and lastly, the physical activity counseling. The last part is again the most missed one. I hope if I find any cardiac rehab physical therapist or any physical therapist with me, I hope they will agree with me that what we do is we work on all other components. We just go there, we assess the patient, we assess the neurological aspect, the cardiac aspect, the musculoskeletal aspect, any other comorbidities, yes, no, सब कुछ करा के, and then we go and write the management plan. जो exercise करानी है आपने करा दी, and उसके बाद you're gone. You do not counsel. The most of what I have seen in my life as well, throughout this 8.5 years of my career, I have seen this thing, that the most missed point is that we do not counsel the patient for physical activity. So it is a core component. You have to do that. Now, how you can just reduce how can you just reduce the risk factors? If you talk about blood lipid, you can just ask the patient what is your lipid profile. Then you will ask about the hypertension control. You can talk about the glucose intolerance. I think you should need to know these important things. I'm just going to give 1 to 2 lines for each of them. How you can just control, or how you can just reduce these risk factors. Whenever we talk about lipid profile, I told you few moments before, जब भी आप लिपिड की बात करते हैं, जब आपको खुद ही नहीं पता होगा कि लिपिड क्या है, उसकी कितनी टाइप्स हैं, उसकी नॉर्मल रेंज क्या है, how will you be able to tell the patient? So the first thing is you should have the sound knowledge of it. So talking about the blood lipids, there are 2 types of lipids: the low cholesterol, the high density lipids. If you have studied biochemistry, you must be aware of these terms. You can just you have to focus on a significant reduction of your total cholesterol, and you have to focus the patient on increasing their HDL levels. If any of you is unable to remember which cholesterol is good and which cholesterol is bad, I just always remember it with age. HDL is high density, H for high density, H for happy. So HDL is good cholesterol and LDL is bad cholesterol. Good cholesterol ka matlab hai you have to keep it as high as possible. The lower range is 35 millimole per liter. It should not be lesser than 34.5, and the upper range is as much as, right? And when you talk about the bad cholesterol, that is LDL, that is low density lipoprotein cholesterol, you have to keep it lower than 200. Then the other component is hypertension control. How you can tell the patient about hypertension control? There is a flexible regime. Basically, you can share with them an extensive but flexible regular exercise program that can help their artery to build elasticity. I hope agar aap mein se kisi ka research mein interest hai, you must have just came across this research. It has been recently published in Lancet. I was going through it. That states कि जो आपकी exercise है, it basically it's a myth. शुरू में ये myth समझी जाती थी the more you exercise, the more you will live longer. But the physiology behind that is the more you exercise, you are enhancing the elasticity of your arteries, right? So you can tell the patient about regular exercise pain in if they want to control their hypertension. Secondly, you can ask them to ensure the good blood flow and the normal blood pressure. How you can ask them कि वो अपना blood pressure maintain करें, ask them to cut down their stressors or reduce their stress, any kind of stress. Then you can
दर्जन में 12 दाने होते हैं ना, अब 12 दाने.
I hope Kinza Mansoor, can you please mute your mic, please? So we were talking about hypertension control. The first one was flexible exercise program. The second one was telling them how to cut down their stressors or their stress level. And the third one is maintaining consistent long-term exercise. There is a great benefit. I have read it. I just cannot recall the reference, but I have read it somewhere that if you just reduce the salt content in your diet, you can reduce your blood pressure by 5 to 10 millimeters of mercury. And if you maintain or if you follow a consistent exercise program, you will be able to reduce 10 to 20 millimeters of mercury in your blood pressure. So 10 to 20 millimeters of mercury is a big range. If anyone is here is from cardiac rehab program, he will be aware कि अगर किसी मरीज का 5 millimeter of mercury भी blood pressure high हो जाता है, so what is our state? So basically, these are 3 steps you can follow. You can help the patient maintaining their hypertension levels. Then how you can tell the patient about maintaining how the patient can maintain get rid of that glucose intolerance. You can tell them to reduce their serum triglycerides, जिनको हम TGCs भी कह रहे होते हैं, and their body fat level. So basically, the more the fat, the more will be glucose intolerance. The lesser the fat, the lesser will be glucose intolerance. Then you can also tell them to lower their serum insulin level after training, because in insulin sensitivity at the cellular level is enhanced when you exercise. So exercise is not only increasing your elasticity of vessels, it is also helping you to decrease or to maintain the glucose intolerance. So these are a few of the things that I just want to that cover the first half of this webinar. The second half starts with the cardiac rehab phases. Dr. Nasir, do we have time to do that, or we can just leave it for the next? Yes, I am under the weather these days.